Let me try to do like I always do, try to do some summaries here before we close out the show. We talked about progress, and what came across to me is analytics are playing a big role in the progress. Better analytics and analytical tools and are moving us to better point of care using data in order to we heard on progress about telemedicine and the need, how telemedicine can make dramatic improvements in reaching folks and providing health care to those that maybe are in situations where it's difficult to get to a provider facility. Some of the specifics, standards and interoperability came across as two key things that need to be looked at. We heard a real nice, noble story about free vaccines for veterans at Walgreens. I thought that was a very interesting, specific thing. We heard about secure messaging solutions and how important it is if we can get secure messaging moving around, then we can move this health data around and feel confident in doing that. And we heard about big helping small. There was a messaging here. Some of the bigger providers were able to offer things and then pass them on down to smaller providers in order to help them get on board. Lessons, standardization and consolidation remain big issues. Engagement of the consumers came across loud and clear as something that's important in collaboration with them. Focusing more on the people rather than technology, person-centered approaches. We talked a little bit about the role of the clouds, plural clouds, as well as culture change came up pretty much throughout the entire show and just how tough that is, especially came up in the challenges section. Also in challenges, we talked about cost, compliance, commitment, and competition being key items that are challenges out there. Future, what I heard, movements towards personalized medicine, proactive healthcare, trying to get out there in front and keeping people healthy so they don't get sick, and focusing on outcomes, which I thought was a very interesting point to focus on what outcomes are we trying to achieve as opposed to traditional ways of looking at things.